Starting this weekend, there's going to be a lot more testing available for people who want it. The National Guard is offering drive-up testing in rural counties, and then the Metro Health Department is also testing a higher percentage of the people who actually come to them for test. And News 4's Nancy Amons has more.
Nashville now has another lab ready to take on COVID-19 testing. Aegis Lab said they didn't offer testing at first because they weren't sure they could get all the supplies they needed, and they didn't want a backlog of cases.
We want to be able to do what we say we can do. And so if we say we're going to give you a 24-hour turnaround time, that's what we want to be able to do.
Aegis will have the capacity to process about 3,500 samples a day. They'll ramp up if the need arises. If you're tested at one of Nashville's 3 drive-in testing sites, your swab could end up here at Aegis. Aegis will also process some of the tests taken at sites manned by the National Guard. They're helping rural health departments ramp up their testing. Governor Bill Lee is expanding testing. He wants to locate and isolate people who have the virus.
We encourage every Tennessean who isn't feeling well or who has come in contact with someone who has had COVID-19 to get a test.
Remember, at first, Metro was very selective about who got tested. Initially, only older or sicker people who had a number of symptoms. Only 66% of the people who applied made it through the screening process. Now it's 90%. Why is more testing good? Aegis's vice president of lab operations says because you could feel fine and spread the virus without knowing you're infected.
You can spread the virus while you're asymptomatic, and so that's where a lot of this community spread occurs. Is I feel fine, I don't know I'm contagious, I go out to a party or to the store or wherever, and I pass on the virus to you, and then I start feeling symptoms 2 or 3 days later, and at that point it's too late.
Now, this is important. If you went to one of Nashville's testing centers run by the health department, you have to have an appointment. You have to report having some kind of symptom. That is not the case at the National Guard testing centers that are being set up across the state. You can go without any kind of pre-screening and no appointment is needed.
Okay, do you have to live in that county, though, to be able to take advantage of that?
No, that's a really good point. If you live in Nashville and you want to get a test in Wilson County or Cheatham County, you can. You don't have to live there to get the test at those National Guard run testing stations, Lauren.